overview of the school-based health center model in Oregon. I'm Kate O'Donnell with the Oregon Health Authority, and I will be co-presenting today with
Tammy Alexander. I'm from the Oregon School-Based Health Alliance.
And we are also joined by
Melanie Potter with the School-Based Health Center team.
Great. Thank you, everyone. Great. So, as you are all aware, the goal of this webinar is really to provide an overview of what the school-based health center model looks like in Oregon. We have a few key objectives to accomplish today. The first is to kind of provide a historical overview of the development of the school-based health center model in Oregon, to provide an overview of our current model that's outlined in our school-based health center certification standards, to provide some context on how funding is delivered to school-based health centers in Oregon, and how you can get involved if you are new to the movement. We're really hoping to provide this overview for folks both who are new to school-based health centers and to folks who have been with school-based for a long time and might want a refresher. Kind of the original intention of this webinar was for new staff, new medical sponsors, folks who have not really they've gotten maybe piecemeal information about what school-based health centers do and what the model looks like, but the goal is to really provide kind of a comprehensive introduction to kind of answer all those questions for you. So Tammy is going to get started with an overview of the history of school-based health centers.
All right, let's start at the very beginning. So school-based health centers have been around since the late 60s and early 70s. They started in Massachusetts, Texas, and Minnesota. School-based health centers were established in Oregon in 1985 as a result of the Teen Pregnancy Task Force that was active at the time, inviting Dr. Phil Porter to come talk about a new model of care that would address teen pregnancy. That model of care was known as the school-based clinic. Our first school-based health center opened in Roosevelt High School and quickly became a model of care that was well recognized and needed. Despite the vocal minority, bomb threats, and other shenanigans, school-based health centers began to get a foothold, and within 2 years, the efforts were nationally recognized at the Council of State Governments for their Innovation Award for all the work that was taking place in Oregon. What was so different in our state than other states is that the Oregon legislature was very supportive and provided general funding dollars for it. Yet in 1991, school-based health centers took their first budget hit and lost about half of their budget. However, they were able to keep their doors open and seeing kids anyway. In 1993, things began to change. The Oregon Health Division had a staff person who was assigned to take care of school-based health centers for the first time. Prior to that, school-based health centers really never had a home at the state level. And by then, there were 18 school-based health centers in 9 counties. And the first fully organized, what we called Advocacy Day back then, took place at the Capitol, where health centers from all over the state brought kids and brought them there to tell their stories. By the end of the legislative session that year, now remember, we didn't have our full funding. The funding was restored. And Governor Roberts, for the first time, put school-based health center in the rules of funding. It wasn't great, but it was a start. And that wording encouraged counties and other health entities and insurance companies to work with school-based health centers. In addition, in 1993, that was the year we held the first statewide conference where we began the discussions of becoming organized to become the voice for school-based health centers. 1993 was also pretty important because that's the year we wrote the Robert Wood Johnson Grant. It was the first time Oregon was allowed to apply for those monies, and we were awarded the grant. It was $2.3 million, and it was called Making the Grade, and that was a game changer in Oregon. So Making the Grade was the Robert Wood Johnson initiative that helped the funded states and their local partners establish new school-based health centers and promote policies to sustain the centers over the long term. It was very exciting times in Oregon as we were in the early years of the Oregon Health Plan development and Hillary Clinton's health care reform efforts. This grant laid the foundation for the ongoing policy work on behalf of school-based health care in Oregon, in addition to funding new sites. the policy work really put school-based healthcare at the table with other healthcare systems and agencies for the first time. It allowed Oregon to build the capacity of what we now call the State Program Office to develop standards, initiate data collection and reporting, determine a funding model, and it brought school-based health centers from under the radar to fully out in the open. Outside of Oregon, the Robert Wood Johnson initiatives and other states that were coming along as organizations, they were coming together to say we need a national organization to represent school-based health centers. And from all that effort, we launched basically the very first national organization, and it was known as the National Assembly on School-Based Healthcare at the time, and it is now known as the School-Based Health Alliance. So continuing to tell the story a little bit about the history, making the grade, as I said, was a game changer, and it really kicked things into gear. School-based health centers often operated in a very low-key way. They're trying to do their work, stay out of the limelight, to avoid the distractions and the controversies that often arose from the vocal minority, especially around contraception and parental rights. The strategy became different in this new era. School-based health centers were recognized as safety net providers. The state was requiring encounter data. The Oregon School-Based Healthcare Network, now known as the Oregon School-Based Health Alliance, was one of the charter members of our national organization. And school-based healthcare continued to grow in numbers. And the legislature continued to fund additional sites until 2003. There were budget cuts all around in 2003, and some school-based health centers and the state program office had to shut down briefly. Bridge funding was found to keep the doors open at the centers. Volunteers actually came in to the health division at that time and did the work of the state program staff until the money was restored. These efforts demonstrated the power of the school-based health center advocate. All right. So I'm just going to hit some high points from 2003 forward because it would take us longer than we have during this webinar to hit all the key points. But over the past 10 to 12 years, it's been a time of growth, change, challenge, and success. The years of data collection, you as advocates, and the youth telling their stories during awareness days at the Capitol, inviting your legislative representatives to your sites, the state program office work, and the alliance work collaboratively together to develop policy options and a vision for school-based health centers. All this has culminated in bipartisan support, even in down economic times. And I'm highlighting just a few of the successes. For example, in 2007, with the new money, 18 planning sites were in the works, and the state program office continued to add positions and strengthen their work. And there was the addition of a 20% increase to the funding formula. Same thing in 2009, more money, there was new funding formula, Healthy Kids expanded insurance coverage for youth, resulting in school-based health centers being able to increase revenue through billing. And in 2009, there was somewhere in Oregon a student that actually became the 1 millionth visitor to school-based health centers. In 2010, many sites around Oregon applied for the federal money that resulted in over $7 million for capital expenses and improvements. One of the biggest policy wins for school-based health centers in Oregon was during the 2013 legislative session, where House Bill 2445 and the mental health expansion monies made the overall state budget for school-based health centers over $15 million. And at the site level, what that meant for you was that there was a bump in the base funding of $12,000 per site if you had more than one school-based health center. To wrap up this section, we just need to pause for a moment and look back and think about 1985 when the school-based health center movement took seed. And as a direct result of the work of many passionate people advocating for the model and for the Oregon youth, school-based health care and the centers are solidly in place and they continue to grow. There's always work to be done to keep what we have and to dream about the future. This is because they work. So now I'm just going to turn it over to Kate, and she's going to talk more about the model and more about the funding of the model.
Great. Thanks, Tammy. So hopefully that provides you a pretty solid background of where we started and where we are now. So as Tammy said, I'm going to talk about some of the more specifics around the Oregon model for school-based healthcare. And hopefully most of you on the call are very familiar with the document that's on the screen right now, and that is our Standards for Certification, recently updated in 2014. And these really outline some of those key pieces that define what school-based health centers look like in the state of Oregon. Our certification standards outline everything from the actual process that you need to go to become a certified school-based health center in Oregon, requirements for sponsorship agencies, requirements for facility, requirements for operations and staffing, lab diagnostic services, minimum service requirements, and data collection and billing. So as Tammy mentioned, these standards were first implemented in 2000, and really the goal was to create a clearly defined model of care in Oregon and to standardize what school-based health centers look like in our state. There still is pretty considerable variation across the state as far as how these standards are interpreted, but these key features are really what keeps it consistent across the state. And finally, the goal is really to ensure that we are using evidence-based best practice in the delivery of health care through school-based health centers. I'll just mention here that certification is a voluntary process, and you don't have to be a certified center to operate a school-based health center in Oregon. However, only sites that meet the model outlined in the standards are eligible to be certified, and only those sites are eligible to receive funding through the Oregon Health Authority and the State Program Office. So that's everything from our base funding to grants that become available through the state. We were recently written into rules in 2014. You can find those definitions on our website. They are defined in the OARs 333-028-200. So you can look those up online on the Secretary of State's website too if you're interested. So this is a diagram of our certification process. You can also find this on our website. The website is healthOregon.org/SBHC. There's also a webinar on there for a more detailed overview of the certification process for new sites, and that really dives even more deeply than we have time for in this presentation, but can give you a pretty solid overview of what this process looks like. But essentially, what it starts with is for new sites, there's an initial application process where you apply to become a certified site. We do an approval of your application if you meet these criteria. You set up a profile in our online data system. And then if you meet those criteria, we do a review of your facility. We review your policies and procedures. We follow 2 primary care visits. And then we produce a report that allows you to address any outstanding action items. And then once those things are complete, once you're deemed to be in compliance, you are certified and you're eligible to receive funding through our office. This process repeats itself every 2 years, so every biennium we go through a process of revisiting all the sites that we have that are certified and verifying that they are maintaining certification standards. You don't have to submit an application each time, but our office will contact you if you're a certified site and let you know if you're due for certification. Because we are fortunate to have so many sites around the state, we actually do a representative sample of all of our sites within each system. So the system is defined by a medical sponsor. So not every site receives a verification review every 2 years necessarily. And again, our certification webinar really goes into more detail about that process. Another key piece of the school-based health center model is the sponsorship agencies. So each school-based health center has at least one sponsorship agency, the most important of which is the medical sponsor. So the medical sponsor provides funding, staffing, medical oversight, liability insurance, and billing support. Medical sponsor owns your medical records, provides a medical director for oversight, and usually has a written agreement with either the local public health department or the school to provide medical services at the school-based health center. As you can see, there are a wide variety of sponsors across the state. However, in this current school year, 72% of school-based health centers are sponsored by federally qualified health centers, that's FQHCs, and 57% are sponsored by local health departments. That's LPHAs, local public health authorities. 38% of those have FQHC status, so they are recognized federally qualified health centers. And our most recent data indicate that 44% of these medical sponsors are recognized patient-centered primary care homes. Also important just to note that there can be a mix of responsibilities. So I said that school-based health centers they have a medical sponsor, but there can also be shared responsibilities between that medical entity if it is not a local public health department. But oftentimes the local health departments are involved in the operations of the schools. Same goes for the actual school itself. It really is a collaborative partnership between all these entities to ensure smooth operations of your health center. We require that each school-based health center and system designate a site coordinator to oversee the day-to-day operations of your school-based health center and serve as a liaison with the local public health department for reasons that hopefully become clear in a little bit. Our certification standards also outline some requirements related to the facility and operations. You can see, again, as I said, our centers look really different across the state. So some are in mobile units or standalone outside buildings. So in the upper left, that's the Gilchrist School-Based Health Center. And the lower left is the newest school-based health center at Beaverton High School, is a building actually across the street from the school. Others are actually in the building. So the upper right, I think, is Eagle Point, is part of the actual school facility. So they can be in a variety of different places. However, we do have certain, again, requirements that standardize these different facilities. So they do have to be located on school grounds, so property that is owned by the school. They cannot be a mobile unit. So they can be a modular, but they cannot move between different school facilities on a given day. We require that they have an exam room, waiting room, bathroom, office area, secure record storage area, and lab space. And we also emphasize the need to protect confidentiality, so having appropriate soundproofing, window coverings, private exam rooms, etc. Again, these are all outlined in our certification standards, and we're happy to chat with you about specifics here if you have questions. We also require some minimum operation hours. So the centers are all required to be open 3 days a week when school's in session, and for a minimum of 15 hours a week. We ask that all SPHCs maintain CLIA license for the level of testing that's being performed at the school-based health center, that they meet Oregon State Public Health Lab requirements, and provide vaccines according to the Oregon Vaccines for Children program. You can see a list on the slide here. These are some services that you'll see at most school-based health centers, and those pieces about mental health and oral health are service areas that we're really seeing grow of late at our school-based health centers. Typically, you'll see mid-level providers offering care at our centers. That's nurse practitioners, physician's assistants. You also see pediatricians, dental hygienists, qualified mental health providers, registered nurses, medical assistants, and office assistants. We do also have certain requirements related to the amount of time that certain practitioners are providing care at centers. So support staff are required to be on site 15 hours a week. Primary care is required for 10 hours a week, and any additional care, there's a requirement of 10 hours a week, but that can be flexible to meet your site's needs. So that could be mental health, primary care, dental health care. Requirements for these comprehensive services are site-specific. They depend on whether or not your site is located in an elementary school, middle school, or high school, and those are outlined, again, in the certification standards. You can see more detail there. But just some highlights to share with you for this most recent school year. School-based health centers around the state served 23,797 clients in 70,666 visits. 57 school-based health centers had a mental health provider on site. 32% of clients seen at school-based health centers had an adolescent well visit. 26% of all visits related to mental health or substance abuse concern, and 13% of visits had an immunization administered. So you can see just by some of those numbers, we really are providing preventative care. We're really providing adolescent-centered care, care that's centered around a whole child approach to really meet the needs of Oregon's youth. I'm going to talk briefly about data and billing. This is another key piece outlined in our certification standards. We do require each school-based health center to submit data to the state program office twice a year, so a mid-year data sample and an end-of-the-year sample. You can find a list of required variables in our certification standards if you have questions. We do also require some other things that we have in place for quality improvement. So each center is required to administer satisfaction surveys to clients. The numbers of these surveys that are required vary, but our office communicates at the beginning of the school year what numbers are required to be collected. Many of our sites actually administer these surveys on iPads. Some still do paper surveys and send them to our office. And this information is used to just assess the level of care provided to clients, to see that the clients feel supported. And the data that we gather from these surveys is reported out in our annual status report or status update documents. We also require sites to gather information on what we call our key performance measures. And this is a quality improvement initiative that was established in 2007, 2008?
7.
Okay. Yeah, quite a while ago, 8 years ago. And yeah, those measures currently are a comprehensive health assessment, an annual well visit, and a BMI assessment. So the requirement right now is that clients who are seen 3 or more times should be receiving these services, and we have certain state benchmarks set that we are hoping that sites will be working to achieve those benchmarks, and most of them do. This information is usually acquired through a chart audit process, and the sites submit their progress on meeting these measures each October. We are actually in the process of revising these measures and should hopefully have some new information about what these new benchmarks, new measures will look like by this spring of 2015. And those will be rolled out over a 3 to 5 year process until they're finalized. But meeting and reporting these measures are actually tied to receiving funding from the state program office, so something to keep in mind. In addition, each site, as I mentioned in the certification slide, are required to keep an operational profile updated with information, and this is really helpful for the state program office and for the Alliance in just keeping track of what's your school-based health center's address, contact information, hours of operation, who are you serving, and we actually look at this weekly, daily, and it really helps us track what's happening at your site level. And with 68 school-based health centers around the state, it can be a lot to manage. So it's helpful to have this information in our office available. I'll also mention something about EHR. So the majority of our sites are using electronic medical records right now. It's not required, but it is encouraged at our office. About 94% of centers are using EHR. The majority, around 80%, are using Ocean Epic, but others use other systems such as NextGen, Prime Suite, Centricity, Praxis, and so you can see that 6% are not on EHR. But half of those, so 3%, are moving towards EHR adoption right now. So they're in the process of acquiring EHR systems. The last piece I'll mention is, so you can see there's a pie chart there of the insurance status of SDHC clients during the most recent service year for which we have data. We do require that providers be eligible for reimbursement from Medicaid, and that all centers must bill Medicaid for services. Another thing that's important is that our sites have a mechanism for ensuring confidentiality in billing. So that could be like an EOB, explanation of benefits suppression mechanism, just to make sure that those confidential visits stay confidential and that clients feel comfortable accessing the health center. And another key piece that I'm sure you all are very interested in is funding. So the funding mechanism for school-based health centers is a little nuanced and can seem really counterintuitive, I think, when you're new to school-based health centers. But essentially, the funding for school-based health centers is allocated by the legislature at the beginning of each biennium. So we're coming up on the 2013 legislative, or 2015, wow, legislative session. We're ending. So the 2015 legislative session is pretty important because they set what the budget will be for the next 2 years moving forward. And so the amount of money that is allocated to support school-based health centers comes from the general fund, usually, and that goes to the Oregon Health Authority. So the Oregon Health Authority is where the School-Based Health Center State Program Office is housed. And so at the State Program Office, we receive funding, and that funding is directed to local public health departments through the county contracting process, and it's outlined in Program Element 44 to be exact. And so that funding goes to the certified school-based health centers. Again, it's always dependent on what happens in the legislature, and as Tammy mentioned during her historical overview, that can be cut. And so we never really know until the legislature actually grants us the funding and the governor signs off on the budget and things are final. So, so once the funding goes to the local public health departments, the local public health departments can subcontract that funding if they want to a separate medical sponsor. And so that relationship is worked out at the county level, and we typically at the State Program Office don't necessarily get involved, but we do ensure that you receive the funding as long as you are a certified site. You receive, the amount that you receive is determined by what we call our funding formula. And so that is counties with one certified school-based health center receive $60,000 a year, and counties with more than one certified school-based health center receive $53,000 a year. And as Tammy mentioned, this amount has changed over time. Actually, in the 2013 legislative session, that second amount, the $53,000, was increased due to some legislative work with some supportive legislators and with the Alliance. Another piece that's important is, so for planning grants, and if any of you are on the call from planning communities, I know we've discussed this a lot, but planning funds are kind of inconsistently available from our office. We've been fortunate to be able to offer these over the last couple of years, but again, they depend on the amount of funding that the legislature allocates to us. But typically, this is a 2-year process for many communities, and again, it has to follow this 2-year biennium structure, but we award $30,000 for what we call Phase 1 planning efforts. And that is usually a community readiness phase where folks do a little exploration and see, does the school-based health center model fit in our community? We require sites at the end of that process to have a location established, to have a medical sponsorship identified, and to have a 3-year business plan fleshed out. If that's successful and if we have funding available, then sites can move on to what we call Phase 2, and that's $60,000, and that's given to sites for a 1-year process of actually getting a center opened and certified by our office. If you're a community that feels that you're ready to go in a year time, you can also apply for advanced phase funding if that's available, and that's a 1-year $60,000 grant accelerated process to get your center up and running. Again, these are dependent on funding and typically become available in July of each year if they are available. So sites also get funding from obviously a lot of other sources, just because, you know, $60,000 for one site in a county is really not enough to sustain your school-based health center. So you'll see that up on the slide folks receive funding for their centers through billing, through school districts, private grants. Others are really successful at fundraising or receiving, from hospitals, community providers, local businesses. School-based health centers are pretty scrappy, and they seem to find different ways to kind of leverage funding to bring in and keep their centers open. There is one statistic I'd like to point out that in this past school year, the 2013-2014 school year, for every state dollar invested, school-based health centers leveraged approximately $2.40 from grants, billing, donations, or other sources. So you can see a lot of work kind of goes into the funding of the centers. So with that, I'm going to turn it over to Tammy.
So I'm going to talk briefly about the benefits and effectiveness of school-based health centers. I know that many of you on the call understand this information, and sort of like I'm preaching to the choir. But if you are truly a newbie and want more information, I'm happy to get you some references and provide you with whatever you need once this webinar is over with. So we do know from surveys of school-based health students that, for example, 77% estimate they would miss one or more classes if they had to go to a clinic elsewhere. We do know that there are many barriers to, young people seeking care in the community, such as, are their parents available? Would they have to miss work? Do they have transportation? It can be a long wait for an appointment. Or maybe they don't want to go to a pediatrician's office and hang out with the clowns and the balloons on the walls and with the little kids. And some of the adolescents begin to distrust their pediatrician, possibly, on the sensitive issues, confidential issues. So these are just a few of the barriers that they can experience, and school-based health centers can overcome them. Those are the benefits, that they can overcome these barriers. Another sort of research piece is that 71% of students reported having a health care visit in the previous year, compared to 59% of students that didn't have an SBHC in their school. So this results in increased care, increased access to counseling, and preventative services. Some of the effectiveness, you'll see on the screen, academic success, and some of the pieces of physical and mental health. And again, I'm just going to touch on a few of these. But what really, I'm really reminded of the Surgeon General's quote from back in the early 90s, Dr. Jocelyn Elders. Many of you may know this quote. You cannot educate a child who is not healthy, and you cannot keep a child healthy who is not educated. And poor health does have a direct and negative impact on the student's success in school and in life. And yet the link between school-based health centers and school success is often hard to establish directly. Yet we just know that there is preventing further health and mental health problems when they're seen in a school-based health center. It keeps kids in school, by managing things such as asthma, helping with depression. Those are just a couple of examples. It's what the school-based health centers do every day to make sure kids have the best opportunity to become and stay healthy and find success in school. And again, just for brevity on this webinar, I want to point out two additional little statistics from recent studies. One study talked about high school school-based health center users. They had a 50% decrease in absenteeism and 25% decrease in tardiness 2 months after receiving school-based health, mental health and counseling services. And then in a 2000 study found that school-based health centers users for mental health purposes increased their grade point averages over time compared to the non-users of school-based health mental health services. So again, if you're interested in finding out more of the studies that have been done around academic success related to school-based health centers, or about some of the specific effectiveness around physical and mental health, and I'd be happy to get you those references. Let's see. Turn to the right page. Oops. Sorry, I have my pages backwards. Okay. Next slide is on youth. What we do, it's all about the youth. We know the model is youth-centric, as Kate pointed out, especially for the high school youth. Teenagers tend to be in the moment, and it's great that this model can often handle a walk-in visit, or they can get a scheduled appointment that's within a really short amount of time compared to a possible community-based clinic. Kate did talk about the model and the providers and the types that are seen in a school-based health center, and they're very adept at working with this age group. If you've ever worked with adolescents, you either like it or you don't. You're either good at it or you're not. And so what we've found in the school-based healthcare field is that some of these providers stay in this field for, we just had a recent retirement of the very first providers in school-based healthcare. They just started retiring a few years ago. So some of them stayed in the field for 25 years because they were good at it and the model worked and they loved the work they did. And then I assume that all of you have been in a school-based health center and that you've seen them and that they're very different than a typical pediatric office or community clinic. The artwork is designed for them. It's designed by students sometimes. And some of the sites have actually had youth on their design team, and they worked with the architects to actually lay out the design of the school-based health center. I know that that was most recently the case for Beaverton High School. And so not only is the model, you know, focused to be for youth, it's often done by youth. They help with the design, they help with sometimes even the appropriateness of the services and stuff. So it's all about the youth. In addition, Oregon has valued the youth voice since the beginning of school-based health centers. Youth have often been the catalyst for bringing school-based health centers to their school. Then we have stories of, you know, youth saying, we want one in our school, and they, you know, they work hard for years to, you know, gather up the support and make it happen. I've talked about the fact that they actually help design them. They often are the key piece to market the school-based health center, and they're extremely great at telling their stories of how school-based health centers are making a difference in their lives. And our statewide Action Council, formerly known as Youth Advisory Council, is very strong and very active. They've developed and implemented trainings for providers and for youth. They've created links to the local youth action councils or youth advisory councils, or we call them YACs, and helping them to become stronger. And they're often called on by our community partners to participate in other initiatives representing the youth voice. And they're just so critical, whether at the state level or at the local level, to do the work on behalf of other youth. We always need their perspective, their energy, and their voice. And we shouldn't do anything without the youth having that kind of input.
Great. Thanks, Tammy. So this is a snapshot, our most recent map of school-based health centers in Oregon. So we currently have 68 school-based health centers. You can see the distribution around the state. The circles with the numbers inside indicate where there are communities that are currently planning new school-based health centers. And the shaded areas are counties that do not currently have school-based health centers but are working to establish new centers. So you can see there's a pretty good distribution throughout the state. The model is definitely growing as more people, as the word gets out about the benefits of this model. So looking ahead, where are we going in the future? Where do we see ourselves at the Alliance and at the School-Based Health State Program Office in the future? It seems like there's a lot of momentum behind the model, and you know, at the statewide level, we're working to plot a path forward. So speaking for the State Program Office, we have a couple of things that we're working on this year and in future years. So as I mentioned with the KPMs, we're working on quality improvement initiatives to ensure that our school-based health centers are continuing to provide the best care possible for children and adolescents. We're working a lot on ensuring the sustainability of school-based health center operations. So looking at, as I mentioned, so where's funding coming from? How can centers maximize billing? How can they look at revenue streams and continue to strengthen their operations? We're working, as well as the Alliance is also working to initially explore some alternate payment methodologies. So looking beyond traditional fee-for-service, what are other ways that school-based health centers can, you know, be reimbursed for some of the softer activities that they traditionally do. So, many centers are out in classrooms. They're talking to kids. They're in the hallways. They're, making those connections with students and with their families, and they can't necessarily be directly reimbursed for those services. So are there other ways that centers can be paid for the good work that they do? And another thing that we're continuing to work on is continuing to align centers with health systems transportation, with becoming primary care medical homes, and how do we kind of continue to ensure that school-based health centers are at the table with some of these exciting things that are happening with health system transformation. Another key piece is mental health. So as I mentioned, many of our centers are fortunate to have mental health providers on staff, and this is somewhat recently we were fortunate to receive some funding from the legislature to increase the mental health service provision at school-based health centers. And this is something that we're hearing from the field has been such a benefit to them, and there's such a need out there to provide mental health services. And so how can we continue to support this at the state level and ensure that kids are getting the health care that they need for mental health services? And finally, we're continuing to look forward to plan new school-based health centers. So I know I hear a lot from people who are interested in bringing school-based health centers to their communities, and so we're working to support those efforts and provide technical assistance in those planning efforts.
So from the Alliance standpoint, my first bullet says SPO, State Program Office, and that's because we could take all those bullets that Kate just went over and we too support that. We work together on those issues. We just do it oftentimes in different ways because of our roles. We share many roles. We share responsibilities and we share a vision with the State Program Office. We work closely with them to advocate for policy changes, get you more money, and respond to the needs of the field through technical assistance and training, including our annual conference and regional trainings. In fact, the Alliance and the State Program Office, we were recognized last June at the National Convention in Seattle as the 2014 National Achievement Award honorees. We don't think it's that unique because we've been doing it for a while, but we are unique as a state in how we as an alliance, a nonprofit agency, works closely with the state governmental agency that's where the money flows through, and we work so well together that we're a model for the rest of the United States. So there you go. So the difference though between the two of us, and sometimes confusing to the field, but basically the Alliance is your voice, and we do the work on your behalf. We're your membership organization that represents you at many different tables, and one of our key unique abilities is to actually lobby on your behalf. And we can only do that with your support, and this is the beginning of my pitch for membership, I guess. Make sure, I implore you to join as an individual and an organization so we can continue to do the work for you and for the youth of Oregon. And I think this picture, it was from one of our awareness days at the Capitol. That time we marched around the Capitol with our signs and banners and our T-shirts and chanted and got a lot of enthusiasm going, but it just sums it all up. School-based health centers rock, and they are totally for the youth. So with that, I guess we'll go on to our next slide.
So again, as Tammy said, it can be a little confusing at the local level to differentiate between all of these state and national entities working to support school-based health centers. So this slide kind of tries to piece out the different roles that we have. So in the center there, where it says Oregon SBHC State Program Office, so that's Melanie and myself are both representatives of the state agency. We're a part of the broader Oregon Health Authority, and our role is really that certification and funding piece. We ensure that you're up to certification standards and that you're getting your funding. We provide training and technical assistance, so things on like billing and planning and things like that. We coordinate some quality assurance initiatives, so like the key performance measures, We also do data collection and analysis. We collect your encounter data and bring it back to the site.
So the other two organizations are your membership organizations, the Oregon School-Based Health Alliance, which I represent. We are your advocacy entity, and we advocate and provide support to school-based health centers by doing the following. We work on sustainability and expansion, work on promoting cutting-edge public policies that promote quality health services in school, provide the technical assistance and training to school-based health centers so they can be the best that they can be. We support and work on strengthening the valuable youth voice and the leadership to shape programs and policies that affect their health and initiate practices that connect the school-based health center work to the broader school community. The national organization called School-Based Health Alliance, they are similar to us. We are a member of them, and they were started in 1995, and Oregon was a charter member of that organization. And they are the national voice, and they work at the congressional level. And that's comprised of individuals from state and federal government agencies, national and regional foundations, and child health and educational organizations, and school-based health centers. They work hard on your behalf for changes in policy and changes in funding structure at the national level. They were the ones that were able to get us the capital investment money that came through, that Oregon benefited $7 million from that expansion. This year they're going to be trying for more operational funding, and that's what we're hopeful for. And they also provide a tremendous amount of training and technical assistance, and of course the national convention each year. And this year it's in Austin, so hopefully some of you can go to that. So again, I guess I just want to say that we are the membership organization. We have a shared mission with everyone on the call and in this room today doing this work, that we want to promote the health and academic success of Oregon's youth. We do know that healthy kids learn better, and I encourage you to join the movement and help us all do our work for you and on your behalf.
Great. Well, thank you everyone for joining us today for this webinar. I hope that it was helpful in providing an introduction to our model in Oregon. We did want to open it up for questions. There is a question box on your right-hand side of your screen. You should be able to type in any questions that you might have for us at this time. We have about 10 minutes left in our time, so we're happy to stick around if folks have questions. If you do need to scoot and you want to get in touch with us, our contact information is up on the screen right now, too. You can reach out to us. Not seeing many questions.
We did a great job.
Yeah, because we answered all your questions. All right. Well, if okay, great. Well, if there aren't any questions, we'll let you go 10 minutes early. We'll be working to get a recording of this webinar up on the website, healthoregon.org/SBHC. So if there are other folks in your organization that you think would benefit from this, you can check it out on the website in about, I'm going to say a month, just to be conservative. All right.
Thank you, everyone.
Thank you. Bye.